I'm Lee Grauman, and I'm the Director of Training and Policy at Portico HealthNet. After being on pause for the past 3 years, renewals for medical assistants have restarted. In this video, I'll explain when renewals will happen, the renewal forms that will be required, and steps to take to renew coverage. I'll close by sharing how to connect with Portico HealthNet navigators for assistance with your medical assistance renewal. First, let's discuss when medical assistance renewals will happen. Medical assistance renewals take place based on the month you first applied for coverage. For example, if you first applied for medical assistance in August, your renewal month will be August. No matter when your renewal month is, 2 months before your renewal month, renewal paperwork will be mailed. It should be completed and returned as soon as possible and no later than the due date listed on the form. 3 months before your renewal month, you should receive a pre-renewal notice, letting you know that your renewal is coming up and providing instructions for how to prepare. MinnesotaCare renewals will begin in October 2023. What if you don't know when your renewal month is? There are a couple of different options to find out your renewal month. The Minnesota Department of Human Services, DHS, has created a renewal lookup tool that can be used to determine your renewal month. If you're enrolled in a managed health plan, you can also reach out to your health plan to find out when you need to renew. The most important thing you can do to help ensure you receive renewal paperwork when it's time to renew is to update your contact information. If you've moved in the past 3 years, it's especially important that you update your address with your county or the Department of Human Services. Now that we've discussed when medical assistance renewals will happen, let's take a look at the renewal paperwork that medical assistance enrollees will receive. When it's time to renew your coverage, you will receive an envelope in the mail with a blue circle on it. Watch for the circle in blue when it's time to renew. When you receive this envelope, it's important to open it right away. There are 2 different types of renewal forms that people could receive, and we'll walk through each of them. The first type of renewal is called a need to renew. The need to renew notice has bold letters on the front page that say it's time to renew your healthcare coverage, and it lists the due date for returning your form. If you receive the need to renew form, you will need to answer all of the questions on the form, sign the form, make copies of your proof of income, and submit the form to your processing agency by the due date. It's very important to submit the form by the due date to avoid a gap in coverage. The other type of renewal notice you could receive is something called an auto renewal. This notice will list auto renew in the action box under your name. You will need to review every page of the notice to ensure that your information is correct. If your information is correct, you don't need to take any further action. Your health insurance has been automatically renewed, and your program eligibility is listed on the first page of the notice. If any of the information is incorrect, it's important that you cross out the incorrect information, write in the correct information, and submit the document to the agency listed on the first page of the notice. If you have medical assistance on the basis of being age 65 or older or having a disability, your renewal form will look slightly different, but it's still important to open your envelope and complete and return your renewal paperwork as soon as possible. It's important to submit your completed renewal form as soon as you can. You can submit your renewal forms by mail, fax, online through DHS's Renew My Coverage website. You can drop them off at your processing agency. There's even an option to complete your renewal over the phone if you're unable to complete renewal paperwork. After you submit your forms, be sure to look for letters from your county, the Department of Human Services, or MinSure. It may be necessary to send in additional proofs like copies of pay stubs in order to complete your renewal. So to recap, medical assistance renewals have restarted. It's important to complete your renewal so you don't lose coverage. Update your contact information. Updating your contact information will help ensure you receive your renewal paperwork when it's time to renew. If you have recently moved, it's important to update your address with your county or the Department of Human Services. Finally, watch your mail for the envelope with the blue circle. This is a notification that it's time to complete your renewal. When you receive this envelope, it's important to open it right away and follow the steps to renew your coverage. As you can see, the renewal process is complex, and it can be especially difficult for people who don't speak English as a first language and people who have difficulty receiving and responding to mail. Portico HealthNet is here to help. Our expert navigators are trained to assist with renewals, and we speak Spanish, Somali, Hmong, and Vietnamese. We provide interpreters for all other languages. If you would like assistance completing your medical assistance renewal, or you would like to refer people you are working with to our services, please refer to Portico's renewal webpage at porticohealthnet.org/renew.